When you spend too much of time on a cold weather or when you spend too much of time in a air conditioned room, you may feel numbness or cold in your body parts, especially in your hand. It is normal. But what happens when it goes to or when it happens on a normal weather or warm condition? Does it have any causes or does it have any worry about this? Yes, you have to worry. It may be due to any other disease condition related to your blood or blood vessels and your arteries. So today we are going to discuss about the topic that's mainly called as cold hand and what's normal and what's abnormal. So don't skip this video. Let's go.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
Which is the major artery that supplies blood to the hand, mainly ulnar and radial artery. But when you expose to too much of cold, the muscles around this artery will go for a constriction and the blood vessels also go for a constriction and vasospasm also occurs. It mainly occurs to prevent the lung and heart, that is mainly the vital organs, to prevent from the damage. So this is the normal mechanism when you feel or when you expose to too much of cold. What is a major cause for this cold hands? Mainly a disease or condition called as Raynaud's disease. This disease mainly affects the arteries of the heart and the major function is supplying blood from heart to other parts of the body. So in this manner, when an attack or when a triggering factors such as stress or too much exposure to cold occurs, that will affect or that will restrict the blood flow from your heart to mainly called as heart to feet or toes of the feet and the fingers of the hand may be affected. So in this manner a vasoconstriction or vasospasm will occur and you may feel coldness or numbness occurs. So this is the major symptom or the major mechanism for the occurrence of cold hands in your body. What are the types of Raynaud's disease? Mainly including primary and secondary. The primary Raynaud's disease have no cause, but it is seen or it is commonly seen in the patients. But when it comes to the secondary, it mainly occurs due to any other underlying causes such as diseases. So these are all the major types of Raynaud's disease. So we are going to discuss about the underlying causes of a secondary Raynaud's disease. Let me discuss one by one. What are all the common underlying causes? The first common cause is rheumatoid arthritis. If you have arthritis, you may also get the chance for cold hands. And the next common cause is lupus. The lupus mainly including when your own immune system attacks the healthy tissues of your body. And the next common cause including if you have a condition called as scleroderma. It is the other disorder that may affect your skin and causes hardening and tightening of your skin. So this is the third major causes. And the fourth cause including atherosclerosis, that mainly deposits of plaque in your walls of arteries. This is the fourth common causes. And the next common condition including pulmonary hypertension, whether there will be increase in your blood pressure that may result in destruction of your arteries of your lungs. And next common condition including cryoglobulinemia. It is the condition where you have the cold sensitive antibodies in your body that may get into active stage and spread and causes inflammation throughout the body. This is cryoglobulinemia. And the next common condition including Sjogren's syndrome, that will cause a type of dehydration mainly in your mouth and your eye and causes dryness. And the next common condition including Burgess syndrome, which will restrict the blood flow to your hand and feet. What is the other common causes for this secondary Raynaud's disease? Mainly if you go for a too much of repetitive motions, that will also cause this cold hands. And the next thing is if you have any trauma or injury to your hand, that will also restrict the or constrict the blood flow to your hand, that will also cause this common cold hand. And the next thing is medications mainly including if you use too much of birth control pills and if you use any allergy medications, and if you use any hypertensive medications including beta blockers, that will also cause this cold hand. And the next thing is, if you have disorder or a condition called as thyroid related disorders, mainly hypothyroidism, in this manner you may also get this cold hand. And the next thing or next common thing is peripheral artery disease. This will also causes restriction of blood flow from your heart to your hands and feet. So these are all the major other common causes for this secondary Raynaud's disease that will leads to this cold hand. What are all the common diagnostic method? It mainly includes a blood test and a cold stimulation test. In a cold stimulation test, a device will be placed on your hand and you have to go for a exposure to cold temperature, mainly immersing your hand in a ice water. And the device that placed on your hand will detect how much time it will take to go for or come back to your normal temperature. So this is the second common test, that mainly a cold stimulation test. And the next one is nail fold capillaroscopy. In this test, a oil drop will be placed on your base of the nail and it will go for a microscopical examination. In this test, it will mainly helpful to detect if you have the condition called as scleroderma or not. So these are all the major diagnostic method to detect whether you have a cold hand or not. What are all the common treatment methods? The treatment methods mainly aiming to cure the primary and secondary Raynaud's disease. And mainly for the secondary Raynaud's disease, you can cure it by mainly treating the underlying causes. For in case of hypertension, you can use these medications mainly including a alpha blocker by avoiding this beta blocker, and you can go for the medications including ACE inhibitors and calcium channel blockers. So in this or these medications can be helpful to treat your hypertensions also. When it comes to the treatment for infections, an antibiotic will be helpful. It mainly helpful to prevent the complications called gangrene. And the next common procedure that mainly an alternative to surgery is blocking the nerve by injecting an injection. In this manner, you can prevent the complications. When it comes to surgical methods, that mainly aiming to cure or remove the dead tissues. So in this manner, we can prevent the complications called as gangrene. But in so much of cases, this gangrene will occur, so it will be treated only with the help of a surgery called amputation. So this is the major surgical method. So these are all the major treatment methods for this Raynaud's disease and to prevent from cold hand. When it comes to the preventive measures, you have to avoid stress. A stress is a triggering factor for this Raynaud's disease and also causes numbness and cold hand. And the next thing is avoid smoking and alcohol. This will leads to affect your main vital organs like lungs, that will cause pulmonary hypertension, and it will also cause this numbness and cold hand. And the next thing is avoid exposure to too much of cold by you can wear a mitten and a hat and too much of some sweater, that will also prevent you from exposure to this cold hand. And the next thing is avoid exposure to chemicals such as vinyl chloride, that will also cause this cold hand. And the next common thing is avoid too much use of oral contraceptive pills and beta blockers for hypertension. In this manner, you can prevent the conditions or the cold hand. And the next common thing is exercise regularly, because exercise regularly will be helpful to increase the blood circulation to your body and thereby prevent this occurrence of cold hand. And the next common thing is avoid caffeinated beverages and also protect your hand and feet from injuries. So these are all the major preventive and treatment methods that mainly helpful to prevent the occurrence of cold hand. So if you prevent the major triggering factor, you can prevent the cold hand and also prevent the complication gangrene and also prevent the procedure amputation. So these are all about this cold hand and the Raynaud's disease. I hope this video will be helpful for you. If it is helpful, kindly share to the relevant people Next day I will reach you with another topic. Thank you all. Have a nice day.